In this segment of Leading by Example, Dr. Herb Cushing, Chief Medical Officer and Infectious Disease Specialist, and Leslie Weeks, Vice President of Physician Practices, share insights into how healthcare organizations can build their organizational recovery plans.
Hi, I'm Leslie Weeks, Vice President of Physician Practices. Thank you for joining us for this segment of Leading by Example, where Dr. Herb Cushing and I will answer questions and share ideas for restoring patient volumes at physician practices and healthcare organizations.
Practices can begin bringing in additional patient volume to their practices when local conditions permit. That means that the virus has passed its peak in your area and that there's no longer community spread.
It's important to recognize that it won't be business as usual and that you'll need to take on a phased-in approach. So you will learn a lot from your first few weeks of reopening your doors to patients. Throughput of patients will not be as swift. Personal protective equipment will still be in play. Social distancing will still be a big part of your workflow. So those initial weeks will really help you determine at what pace you can safely see patients in your clinic.
As you're developing your plan for reopening, here are some key indicators to think that you're on the right track with making that happen. Measure your volumes week to week and try to target an initial slow increase in patient volumes. Ask your staff if they see any safety issues with the way patients are coming in. Make sure your staff has enough personal protective equipment. Also ask your patients what they felt of the process when they came to the office. Did they feel safe? Did we do all of the right things to keep them safe and to keep the staff safe? The patients and staff will tell you what they think.
It's very important to develop a multi-pronged communication plan. And so that will involve your internal audiences, patients. It's really important that patients know that you're here for them, that you are here to provide safe care to them, and that it's okay to come back into your facilities. Referring providers need to know that you are open for business. They need to understand what your plan is and how you are going about making sure that their patients are safe. You also need to make sure that you communicate with your partners, so hospitals, other healthcare facilities, to make sure that you're in alignment with the plans that they themselves are taking on so that everyone is clear on the next steps and that patient safety is a priority.
You may note that there are processes in your office as you start to ramp up seeing more patients that go slower than they might normally do when you're in full swing before the coronavirus. Examples of those are patient parking. If you're having patients park their cars and wait for a text to come into the office, make sure that you drill that process and that it works smoothly, that the patients can get your texts and that they have time to come in and get registered before they're seen. Think about the time at the registration desk. Is that too much time? Is there plenty of time for your staff to get the right information from the patients? And also think about the flow of the patients in the office. Do they have enough time to get from their cars into the building, to the registration desk, and then to the exam room? You may need to space your patients out more than you would have had to do before the coronavirus.
You still will need to consider using technology. So telemedicine has been a big player in this pandemic, and that will need to continue to help offset the number of physical bodies in your facility.
As you restart your practice, you know that you're doing things right if your staff are not coming to you with safety concerns about breakdowns in universal precautions when you take care of the patients. Your patients will tell you that they felt safe and had a good experience. Those are ways that will let you know that you're doing the right thing. If you just ask your folks on the front lines, they'll tell you what they think. You may observe things in the office too that you're not quite happy with in terms of the smoothness of the process and the patient experience. So rely on your instincts.
Thank you for joining us for this episode of Leading by Example. I'm Leslie Weeks, Vice President of Physician Practices at Spectrum Healthcare Partners. I hope you found this segment helpful. If you have any questions, please contact us. We may have resources that would be helpful to you.